Felicia, you can go ahead and get started.
Oh, okay. Thanks, Christina. Sorry, I missed my cue. Good evening, everyone. It's good to see you. I see the names as everyone comes into the room. And although we are doing this remotely or virtually, I can still feel the warmth in this room. We're going to have a really great conversation today. And also know that the chat is there if you want to share your thoughts, any questions and things like that. Also to connect with one another. It's nice to see who's in the virtual room. So please feel free to put that information that you're here and organization you're representing or you're representing yourself. I'm also thankful to our partners and collaborators who are really helping to make tonight's event possible. Our incredible panel, which I'll get into in a minute, but also our partner, the Labor Education Center at DePaul University. I want to thank them as well. So before we continue, I do need to do this. And although this event is virtual, it is mostly taking place on the traditional homelands of the people of the Council of Three Fires, the Ojibwe, Potawatomi, the Odawa, as well as the Menominee, Miami, and Ho-Chunk nations. We acknowledge and honor the original people of the land and the Native people who remain on this land today. Tonight's topic is really core to CFW's mission. In fact, getting women back to work is one of the pillars in our trademark SHEcovery initiative. SHEcovery is a roadmap for how do we address COVID-19's impact, particularly on women and girls and women of color, and how do we make demands that center women of color across Chicago and wield our collective privilege and power to get women back to work, address the eviction crises, care for our caregivers, and demand an anti-racist healthcare system. Before we begin, we're going to take a look at a short video that highlights the importance of this initiative. And on the other side of the video, I will introduce you to our panelists.
One of the hardest things for any of us to do is to just hang in there while the rope is about to break and the sky is cloudy. It's hard to be positive, but you just have to believe that there are good tomorrows and plenty of good tomorrows. Before the pandemic, I was living in a small one-bedroom apartment. Previously, I was in a shelter. I had run through a rough patch in life, but it just turned out that the landlord was a slumlord. I often had to turn my stove on to keep warm. In researching and calling, I found out about the lawyers group for tenant rights, and that's when things began to smooth out for me some.
In our society today, the stories and the lived experiences of women of color, particularly of Black women, are not deemed worthy. We just have these wounds that just keep getting reopened because there hasn't been an intentional focus and dedication on resources and prioritizing these communities. SHEcovery is really about centering the voices of women in our communities and investing directly and attracting other resources to support women and their families.
The pandemic has hit hardest those communities who were already made vulnerable by systems of oppression that put vulnerable people at greater risk for eviction, for job loss, for illness.
The biggest challenges facing women and girls in Chicago would be getting women back to work, healthcare, and demanding an anti-racist healthcare system and housing.
There has been a housing crisis for some time, and we knew that even prior to the pandemic, women were at greater risk for eviction than men, and women of color were at the greatest risk for eviction. This has been exacerbated by the pandemic.
They helped me with my court case. I also got financial help to be in the apartment that I'm in right now. So far, it's been good.
We have direct experience with tenants. We're in eviction court every day so that people can stay in their homes.
Homelessness is a very traumatic experience for anyone. And so the end to homelessness, right, the end to eviction would really be the dream, the idea that housing is a human right.
Particularly through the pandemic, many women have to abandon their jobs. We have a very extensive leadership program. We have Know Your Right trainings, providing the tools for workers to defend themselves with documents or without documents.
In order for us to have all families thrive and to have all women thrive, we have to be investing in care infrastructure.
In order to have healthy communities and a healthy economy, people have to be able to tend to those most basic needs. And if a person can't cultivate their own individual wellness, that ripples out.
We can't do it just by focusing on one problem. All of these issues are important in order for women to have a full life. We should be addressing them all.
Everything that will help us to become the best that we can be. And if we're not getting it, we owe it to ourselves to fight for it, for ourselves and for those who may not have a voice, but yet would like to speak.
When women are taken care of, they take care of families and they uplift entire communities.
I envision a world where women, girls, trans, and non-binary people can find a way to live out what her great potential is and make the contributions that will better our society.
I want to take a moment before we move on to thank some, because that was a world premiere of this video about SHEcovery, but I wanted to thank some of the partners that were included in the video, and they were Arise Chicago, Lawyers Committee for Better Housing, Chicago Women's Health Center, and Healing to Action. They have all been really great grantee partners with CFW, and we look forward to continuing the work with them to really address a SHEcovery for women equitably across our city. So the ongoing the COVID-19 pandemic, coupled with longstanding inequitable labor practices and policies, it's resulted in women experience the worst economic fallout in our lifetime. While the November 2021 U.S. jobs report showed that the economy gained over 500,000 jobs, it lost 65,000 in education. Child care centers remain heavily understaffed with virtually no job gains, including more than 100,000 fewer child care workers. All of these are jobs often staffed by women, and more often than not, women of color. And at the same time, through slow-moving corporate policy and potential legislation, we are seeing glimmers of opportunity to significantly shift labor in a way that truly works for women. Tonight, we will go beyond the statistics to learn how we can ensure that women can rebuild their careers and in a way that actually works. Thank you to our partners for this event, DePaul University Labor Education Center, Enlace Chicago, One Fair Wage, SEIU, Healthcare Illinois, Indiana, Missouri, and Kansas, and Women Employed. To help us dig in tonight, I'm joined by an impressive panel of friends. Cherita Ellens, who serves as President and CEO of Women Employed. Katya Nuques, Executive Director of Enlace Chicago. And Jaquie Algee, Director of External Relations of SEIU Healthcare Illinois, Indiana, Missouri, and Kansas. Thank you for sharing your wisdom with us tonight, and let's get started. So the SHEcovery report takes a look at the national and local findings on the impact COVID-19 has had on women and gives us a roadmap to recovery. Today, we are focusing on getting women back to work. And as I mentioned in my opening remarks, while the November 2021 U.S. jobs report showed the economy gained 500,000 jobs, it lost 65,000 in education alone. Childcare centers remain heavily understaffed with virtually no gains and that means more than 100,000 fewer childcare workers. All of these are jobs that are staffed by women and more often than not women of color. And also that means that women are impacted or families are impacted with being able to have access to essential childcare. So I know this sounds like a dire set of circumstances, but it's also an opportunity for us to reset, sort of. Cherita, in your work with women employed, are there ways to use this pandemic to reshape the workforce culture to be more inclusive and supportive of women?
Thank you for that. And thank you for that video. It was so powerful. I can't wait to watch it again and really take in everything that was being said. And I'm glad that we're focusing right now on getting women back to work. One of the things that you highlighted about the November jobs report, and everyone's excited about how many jobs we gained, but it is not properly capturing still how many women are leaving the labor force altogether. So they're not being counted in those unemployment numbers anymore. So in November, we know that 91,000 Black women left the labor force. And so when you think about this weakened childcare infrastructure, when you think about lack of access to paid leave, when you think about lack of access to paid sick times, it's impacting the women who need it the most, the women that don't have access to that. In October, I pinned this op-ed in Cranes addressing this question on what we can do. And in this moment, employers, this is an opportunity to meet the expectations of employees that the workplace needs to change, right? Or the loss of talent is going to be harmful to business. LinkedIn did a survey, and 74% of workers said that this pandemic caused them to rethink their current work situation. People are talking with their feet. And so we need employers to care about their employees as a whole person. We need them to make space for who their employees are outside of work, for talking about mental health, for setting boundaries and creating balance, to evaluate your current workplace norms and policies and practices and address those areas that are causing undue burdens on women, on LGBTQ folks, on people of color. Yes, we need flexible schedules. We need hybrid working environments. We need access to benefits. And most importantly, we need to make sure that you aren't mommy tracking people. So people that take advantage of these benefits that you consider accommodations, but really should be basic, essential workplace benefits, that you don't bar them from career advancement because they are deciding to take advantage of flexible schedules or hybrid work environments. We're also at Women Employed building out a consultancy where we're working directly with employers to help them reimagine what their workplace can look like, and do policy scans and all of the actionable things that allow you to take your equity statement from words on paper to actual actions that benefit your workers.
Cherita, I think you raise a good point about the mommy tracking and the fact that when one goes to access these services or these opportunities in their workplace, then sometimes, when they say take sick time, when they actually take their vacation, sometimes those things are marked against them. Somehow then they are said to be less engaged or less, committed. Their commitment is questioned to their work. So thank you for highlighting that. Katya, I have a question for you. So in your work, you're working directly with the community. What are some of the things that you're hearing that are impacting women and their families?
So we actually focus in the South London or Little Village community. So as you know, a predominantly immigrant community in the city of Chicago with the highest percentage of undocumented community residents. So we calculate between 25 and 30% of the population is undocumented. But what happens with that information? Where's the bulk of the undocumented? It's actually the working age, because most of our children under 18 are actually US citizens. So when you think about those factors and how COVID-19 affected not only the physical health, but immediately affected women, particularly in their inclusion in the labor force, because most of the women from our community were actually for the hospitality industry. Restaurants, hotels, they work in laundromats, et cetera. And they were the first ones that had to close their doors and they had to let go of their employees. On top of them being part of the hospitality sector, because of their immigration status, they're actually part of the informal economy. So what Cherita was mentioning about the data and the statistics, sometimes our community, we're the last ones that actually receive fair numbers and good numbers to even trust them, right? Because nobody's counting, like we're, those people that have to work in the informal economy, sometimes in whatever way they have to do it, they're not counted. Right. So we had to actually say, as an organization that works on the ground based on the anecdotal information, that this was happening. Right. On top of everything that was happening in their homes, about 44% of our community is also uninsured in terms of health insurance. So many times, people were getting sick and not actually going to the doctor, especially at the beginning when the programs were unknown, when nobody knew I can actually go to the hospital for this and nobody's going to be sending me a bill, right? And many times they actually did receive bills, and we had to work in the advocacy and the policies that you're mentioning at the city level, at the state level, et cetera, to make sure that people knew that these programs were covered, right? That they were covered by the federal government, that people shouldn't be receiving bills for ambulances, or for taking care of their health. So on top of everything, women were dealing with trying to get their family, like the medical attention they needed. Only about 70% of the community had internet access. So you're dealing with 30%, which is a big number of families that were not connected. And they were struggling with this virtual learning, which many of them have expressed that it wasn't virtual learning. It was homeschooling. and probably like a lot of us that have children at home can relate to that, right? That it was really homeschooling, especially again for the women, right? That decided to stay home or were forced to stay home, take care of the ill, get the medical attention necessary, take care of the children, and continue to put food on the table, which was also such a stressful situation. Fortunately, I have to say that because of the very strong coordination at the local level, we had a very good system to get people connected to the resources that they needed. We met as a community every Monday at noon for 2 years to be able to interchange the information for everybody to know, where do you go if you need diapers? Where do you go if you need food? And then we were also part of the racial equity rapid response with the city to be able to to change those trends that were very, very negative at the beginning, both as with testing and vaccination. At the beginning, the trends were, who's getting vaccinated and tested? White people from affluent neighborhoods, not the people that actually needed it. 60623 was the zip code with the highest incident of COVID for weeks and weeks and weeks, right? Until we actually were able to change those trends, like I'm saying, and to vaccinate people in the 10,000s, et cetera. It took a little bit of time and a lot of work.
Katya, I think that's really important. I mean, you're pointing out the importance of grassroots organizations in our communities, people who understand and know the community inside and out, who are able to say and help target resources when they're needed. I mean, it's too often, we see this time and time again, organizations, government philanthropy does this too, where you come into a community and you don't work with the coalitions that are already there on the ground. And I have very fond memories of my time working with Enlace and all of the partners from when I was in the mayor's office, and how centering the community was the right thing to do instead of coming in with a top-down approach. And because of that, you saw the success of the outreach that you have done in the community at pushing down those numbers and also getting shots in arms, which is really commendable. So thank you for that. Jaquie, you are working with workers in several states who are on the front line, who are nonstop, who are, beyond overdrive at this point. And as a reminder to everyone who's tuning in tonight, it's the minority of people who have the opportunity to remote work. So Jaquie, the population, the workforce and healthcare that you are working with in several states, can you tell us a little bit about what some of their most pressing concerns are and how it's been for them, and also thinking about there have still been some challenges with some of the jobs in healthcare, despite the fact that we're in a global pandemic, and what is being done there too.
Sure. Thank you, Felicia. And I just want to say that, first of all, as SEIU, or representing SEIU in this discussion, we are really, really proud to be a part of this collaboration. The report is amazing. I feel the similar as Cherita, that I look forward to seeing that video again, because it was just dynamic. It just moved me in so many different ways, both personally and otherwise. So we represent 4 industries of workers. And when you talk about essential workers, that became the tag word, if you would, especially during 2020, as the pandemic was growing, right? So the essential workers, well, these are workers that have been essential all the time. They didn't just become essential during the pandemic. So the industries that we represent are childcare, healthcare, home care, and nursing home workers. Over 90,000 workers throughout 4 states, Illinois being the largest, but Indiana, Missouri, and Kansas as well. The interesting thing that happened during this, the awareness that came about during the pandemic was not just the fact that all these workers are essential. Yeah, they're essential for a number of reasons. They're essential for other workers being able to go to work. They're essential for other workers not only from the standpoint of having childcare, right? But also for people who are caring for others, as in their parents and other family members. So we have essential workers that have been doing this kind of work, not just during the pandemic, but all along. This is what they signed up for. But the problems that were happening with them then and still now, which we fought really hard for. And when I say we, it wasn't the union that fought hard. These workers fought hard to make sure and to say, we've got to be safe. We've got our families and our communities to go back to. If we're in these places, whether it be in a private home, in a nursing home setting, in a hospital, or whatever the setting might be in terms of care giving, we have to be safe to be able to not only give care, but to return home. And what was happening was there were a lot of situations, and the numbers really just skyrocketed in terms of seniors, unfortunately, who succumbed to the COVID virus, and workers as well. And some of those seniors were in nursing homes. Some were seniors that people were taking care of in their private homes. So safety was really important. And they were not getting the PPP that they needed to. They were not getting the protective equipment that they needed. I remember one time that we did a protest march, if you would, out in front of a nursing home. It was during the time that we were striking. And they had given them one mask to wear for the whole week. One mask. And they didn't even give them gowns to cover themselves, because keep in mind, we didn't have the vaccine at that time. So it was just widespread, right? And you did not know, you still to some extent know who is actually passing it on, if you would. But they would give them like garbage liners, garbage can liners to cover themselves. And these majority of the people that still are providing these services, both in the childcare setting, healthcare, and home care, are women of color. And so they go back to, and everybody's talked about that, they go back to their communities, their homes, their families, and take whatever, and at the same time, still doing the work. Now, we did have some fallout, to Cherita's point. 100,000 childcare providers are not in business anymore. And they can't go back because of several reasons. One, the childcare, the cost of childcare alone, which was already, in existence before this, but even more so now, because now you got a double whammy. You got people that are not working to make good salaries or living wages to even afford childcare, right? So, it's a domino effect, if you would, on our society. When you talk about essential to the society, these workers are essential to making sure that things continue to run. I hope I answered your question.
Jaquie, thank you for that. One of the sad points really of the pandemic for me is the realization that overwhelmingly on our front lines, we have a lot of women of color and a lot of the immigrant community. And essentially they were helping to keep our communities intact, right? Providing essential services. And yet, for many of their organizations, for them personally, right, they may not have been provided adequate protection equipment. And in some instances were required to get that protection equipment themselves.
Okay.
They also may not themselves have access to things like healthcare themselves. Mm-hmm. They may not have had access to paid sick leave themselves, right? All of these basic essentials for supporting and remembering, and you reminded us, they were also taking care of their own families. They were trying to make sure that when they came home, they were the only thing that came home with them, right? And so they're trying to protect their own families and also support our communities. And I will say, as a foundation, Chicago Foundation for Women, and for other funders, it's really important that for these nonprofits and these organizations that they get essential general operating support. These things, programmatic dollars are great, but we need to do a better job at supporting them holistically with general operating support. So that's one of my soapbox moments for today. Cherita and Jaquie, the service sector has taken a significant hit in job losses, but we are seeing some employers respond positively by increasing wages and adding benefits. You, Cherita, are co-lead, and Jaquie, a steering committee member of the Illinois Coalition, working to end the sub-minimum wage. What are you seeing that's happening in the service sector that perhaps other sectors should pay attention to? And for some of our folks, can one of you just break down the sub-minimum wage so that we all understand how problematic it is for these workers and our society, quite frankly?
You want to go, Cherita, or?
You go ahead and go first, and I can pick up from you.
Okay, that's fine. And so, sub-minimum wage, it hurts me to even say. It's a disgrace to even say the amount of money that someone would be paid, compensated for the work that they do for 8, 10, 12 hours is just, unconscionable. When you have people that are working and making $2.35 an hour plus tips, $6.15 an hour plus tips, and yet you want them to come into your establishment and keep it going, right? And so what a lot of the workers are starting to say, and I think we are referring it more to the Great Resignation, is we don't have to take this anymore. And guess what? It is prime time for this, oddly enough, and coincidentally enough, it's prime time for them to stand up and say that, you know, like, you need us, but we're not coming back until you pay us right, you do right by us, you make sure that, again, majority of the people that provide those services are women of color. They look just like us on the screen, you know, and yet they have families, they have responsibilities to take care of, and they want to live a decent life too, even if they don't have children, right? They still want to, they work 8-10 hours, they want to get paid adequately. And so they're saying, no, I'm not coming back to work until you can pay me right. Because guess what? They're having to endure. It's some of the horror stories that we're hearing, especially from restaurant workers, is unbelievable. It's, again, a disgrace. When you have people that are saying to them, oh, honey, pull your mask down so I could let you know if I should give you a tip based upon how you look. Really? Oh, so anyway, you know, those are just some of the things. I mean, and they're being very rude to them. They encounter things like they have to play police persons in a sense. They have to police the venue because they have to tell people you've got to keep your mask on unless you're eating. And some of the responses they're getting is similar to what the CTA bus drivers and train drivers are getting as well. And so that's a disgrace. And so this movement to really, you know, stand up for sub-minimum wage and not only have it be centered around wage increase, but also respect on the job as well. Cherita, you got something?
Yeah, thanks for that, Jaquie. To kind of level set so that people understand the need to address this and how many households and how many families are impacted by individuals that are still making sub-minimum wages. So there are over 200,000 tipped workers in Illinois. So this is not just a small portion. There's over 200,000. 2/3 of these workers are women, 36% of whom are mothers. We also know that 9 of Illinois' 15 lowest paid jobs are tipped occupations. And of course, women are the majority in over half of them. And in general, tip workers are 2.5 times more likely to live in poverty than the overall workforce. And among tip workers, female tip workers have a 44% higher poverty rate than male tip workers. So there are males that work in this industry, but they're the ones that are in the high-end restaurants that are making minimum wage and really good tips. So they're earning living wages. And we know that that is not the same across the board. So if you just sit back and you think about that for a second, and you also know 80%, more than 80% of the Black mothers in Illinois are either sole or primary breadwinners. So when you connect all of these dots and you think about the impact this is having on families, on our communities, and then you add the pandemic on top of that, and we know that many of them were not able to access unemployment benefits because the state deemed that they could not count their tip wages. Now all of a sudden their wages, they couldn't count their tip wages towards their income, so they couldn't qualify for the unemployment benefits, the safety net that is supposed to be there for all workers that we all pay into, right? So that we can have that, you know, to help weather those storms. So we know, yes, people are talking about a labor shortage and people don't want to go back to work. They want to go back to work, but it's not just about wages. These jobs are unsafe. They want to go back to work once they know that their health and safety are taken into consideration and centered. They want benefits. They want predictable schedules. We have that benefit here in Chicago, but outside of Chicago, it does not exist. They don't want to make poverty wages. They want to have an opportunity to advance, right? Because they want to be able to sustain a family and not have to work 3 or 4 jobs to do that. And yes, Felicia, you talked about there are restaurants. So I want to hold up one in particular. There's a restaurant here in Chicago, Lula's Cafe. So we want to support the businesses that are doing right by their people. Lula's Cafe took the pandemic and took it as an opportunity to rethink their business model. This is the business model that the Restaurant Association says that wouldn't work, that they can't pay their people full and fair wages. So they're right now offering $18 to $24 an hour in wages. They also are offering healthcare benefits, paid vacation, and 401k. And guess what? Lula is not struggling to hire. So if you do right by your people and you stop paying poverty wages and undervaluing the service that these people are giving every day when they come to your establishment, then maybe you won't have this labor shortage and you won't have to cut your hours because you can't find enough workers to work.
Cherita and Jaquie, these are all really important points. And it just makes me think about so everyone sitting at home, your family members, we all have to eat, right? I'm just going to call that one sector, right? So for the restaurant business, a lot of people aren't necessarily cooking at home. And during the pandemic, there was a lot of all the deliver to your door kind of services, right? But there are employees on the other side of that. And so even on the normal times prior to the pandemic, when we would go out to a restaurant and these services are being provided to us, and many of us don't pay attention to it. We're not very careful in how we tip. And I, want to take this opportunity to say to everyone listening, I have made it a personal pledge of myself because all of us are benefiting from care in some way. So I've made it a personal pledge not to be the reason why another woman is paid inequitably. So that means all of the services that I receive, and many of them provided by women and women of color, I pay equitably for those services. I tip because I've been a server and I know how it is to depend on tips. And so some of this is as we push, which we will always do, government and policymakers to do better, as we push corporate entities to do better and to do honorable by their workforce, and particularly the women in their workforce, we also have to look at ourselves and say, I make a commitment not to be part of the problem as well. So I'm going to ask each of you, Katya, I'm going to come to you next. So can you share an action item that you would like to see in order for this pandemic to serve as a reset to benefit women in the workplace?
Yes, thank you. This has been amazing for me to hear all of this information and wealth of information from my colleagues. One of the things that we actually heard from many women in the community, we actually created a little village recovery economic report that I also want to share with everybody. And we were meeting with, of course, all of the colleagues in the neighborhood that are actually working with for development, in business, in the Chamber of Commerce, etc. But we also had a lot of focus groups and interviews with, the women from the community. And one of the things that they were sharing with us is that they are not getting enough training opportunities that are, directly designed for them, right? Many of the women in our community, as you know, 70% of the households in Little Village actually speak Spanish as their primary language. So many women are monolingual Spanish only, right? So one of the desires that they had is that they had training that were actually directed to them, but also internship and on-the-job programs, because we see that many times, plan and design for youth, but not necessarily for women. And that particularly in our community has been something that many times comes up, but it's not always addressed. One of the things that has, for example, worked beautifully during COVID-19 is that we at Enlace have been nurturing and encouraging, and we've received support from the foundation, of course, is to actually support those women that served as health workers, during the pandemic, there was a huge need for those health workers from the community that knew the characteristics, that were able to like tell people where to go for testing, where to go if you got sick, you know, and give them all of those referrals and guide them through processes and help them fill out those emergency forms that were sometimes crazy, right? And that took hours to actually fill out. So there was so much of a need for those services, but we were able to work with, you know, about 40 community health workers / navigators that were trained. And we actually partnered with Daily College for them to receive their training in Spanish. So we actually got to work with the City College of Chicago, translated the entire curriculum, and are now in the 3rd cohort of community health workers receiving a certification in Spanish and being able to work through the pandemic because everybody was hiring community health workers. So, you know, ideas like that, you know, local trainings, partnerships are things that women are in desperate need of.
Thank you, Katya. That sounds like a really good public-private partnership as well. Cherita, what's a policy, what's something you'd like to see change, implemented so that we could have a reset for women and have an equitable SHEcovery?
Yeah. One, for employers, I want them to not go back to the status quo and do the work to change workplaces so that everybody can thrive. And then in terms of policy, we have to look at passing bills that fix the structural and systemic issues that allow the barriers to economic security to persist. So we have to look at paid sick time for all of Illinois. We need paid family and medical leave. It's on the table right now, regardless if it happens or not, we need it in Illinois. We have to look at, you know, passing legislation to ensure that everyone has access to a full and fair minimum wage and for tip workers. And we have to make sure that we're making an investment in childcare, because if we don't fix this infrastructure, people can't go back to work. When schools are closing every other day and children are being sent home because of, you know, exposure to COVID and things of that sort. So we have to take these big actions to make these transformative changes. They aren't little, I get it, but they're long overdue.
Thank you, Cherita. Jaquie, what about you?
Yeah, so for me and for SEIU, I think I know that our biggest concern and what we're pushing for, along with partners like Enlace and others, is for Build Back Better. I mean, that to me, you know, you know, people say, well, it might happen, might not, but it won't happen unless all of us come together and really push for it. And I'm a firm believer in that. You know, there's power in numbers. That in and of itself can help to start that engine that we need, or sustain the engine that we need to keep going, that we're all talking about, right? If we, you know, we know that in that bill, it's going to give us affordable childcare, right? That people can go to work and not have to work to pay for childcare, right? It's going to give us the opportunity for workers of all kinds, all industries, but in particular those service sector industries that we represent, healthcare and home care, in particular in nursing homes as well, give them the ability to get paid for the work that they do, and with some respect, you know, and that would cover some of the things that Cherita talked about. You know, when we talk about people should not have to work at a hospital, for example, and not be able to afford insurance. People should not have to work 2 or 3 jobs just to make sure that they can pay for their living arrangements. And we have people that are doing that right now who can't afford, they work every day, but can't afford to live where they are. You know, they're threatened to be evicted because they don't have enough, they don't make enough money to pay for to live. And that's a disgrace. People should never. That's not the American dream. That's not what we were raised to think, that this, if you do this, that, and other, you check all the boxes, then you're going to be okay. Whether you're, you come here to this country on your own or somebody brings you here, as we were. You look for things that should be, and they're not. And so that's what I'm looking for, to really get the Build Back Better bill passed. We've got some incredible partners, all of you that are here on this panel, and many more who are in the audience, I think. But just make sure that we keep pressing. We've sent 70, I think 100 members to DC a couple weeks ago, and they were lobbying and knocking on doors. And so we just all need to do whatever we can do to let them know that this is important and it has to pass.
And I think you all raise important points, and I am raising that Katya put in the chat that we also have to keep the immigrant communities front and center in this work too, because as the pandemic, came in waves, and there were some relief opportunities or funding opportunities to provide relief to families in our communities. Oftentimes, members of our immigrant communities were not eligible for that type of assistance. And these are hardworking people who are working every single day. So that's a fundamental inequity there. We are, one of the things I have been thinking about a lot. When I was a little girl, my mom would say, if you think about the structural inequities and the racial inequities that have been shaped over time in our country, and particularly in our city, because in a lot of ways, Chicago is a tale of two cities. There's a lot of segregation that happens. Black and brown people are relegated into substandard housing. So let's look at these as compounding. This is compounding interest, not in the good way, not in the way that gets you to retirement, but this is the compounding interest and the burden that a lot of our working families are facing in their communities. So you're already working 2 or 3 jobs just to make ends meet. Your childcare is a big part of that, right? Because you have to have childcare in order to work. Your rent, many of our families are paying more than 30% of their income towards rent, which is, and the formula says that that's not sustainable and that's too much. And they're making tough choices. They're making choices between their, medicine, if it's required for themselves or their children, food, and all of those things. The housing stock in a lot of these communities is substandard. And so, in the video you saw, Lawyers Committee for Better Housing is one of the partners that CFW works with. They go in and get injunctive relief. So all of these things. So your wages, the ability to withstand the economic pressure of the pandemic, centrally dependent on your wages and how much money you had in reserves. And we already know that on average, white women are being paid 83 cents on the dollar. Black women, 63 cents on the dollar, Latino women, 54 cents on the dollar to every dollar that a white male earns for the same work. And Cherita highlighted this. There are servers doing the same work, and male servers don't seem to fall into poverty as much as the women and the persons in our immigrant communities who are in those same jobs. And so I think it's important for the audience, right? We have to really say how compounding this is, because it's not just the one thing, it's all of these things that are happening. But at the base of it are the economics from the money that you earn from work, which is how this all starts. There are a couple of questions in the chat that I want to get to. One we already, I think, covered, which was how can we take action? Maybe not. How can we take action today to address the issues? I know that I think Cherita, Mary Kay, or Sharmili on your team, we're putting in some action items that people could do, calling representatives and so forth, right? There's a lot of advocacy.
Yeah, so I'm gonna put an exclamation point right now. Build Back Better. We have to get that through the Senate. It passed the House, it's not through the Senate, and we have to get it through intact. So when you're making these calls to your senators, you're not just saying pass it, because they're going to pass a version of it. We want to pass it intact that has as much of the equity targets, the equity issues in it, to make sure that people can come out of this hole. So you can, you know, if you don't know how to do that on your own, you can go to our website, womenemployed.org/ACT, ACT, and you can, you know, there's a form you can fill out. You can find out where your senator is. You can send a quick note. All of those things make it really easy for you to do that, but inundate them, inundate social media. They do look at that. Inundate their office, do all of those things, because they will be voting on it in the next week or so. So we need to make sure that we do that, and then continue to get active in other issues around, you know, minimum wage and paid sick days, even if it doesn't impact you. And so here's the other thing, because for a lot of us, and I'm one of those people that have the privilege to work for an organization that provides paid sick time, that provides paid leave. And even in this moment where I'm caregiving for my mother and now have the privilege that I can do that, the majority of women do not. And it's not because of choices they made in their career. It's not that. It is that employers don't have a mandate to offer these benefits. And so, and our country has put on the back burner building an infrastructure necessary to support working families, because they're still running on the model of white men going to the office while their wives are at home taking care of the family. And that has not been the case in our country for centuries, so for a very long time. So we need to make sure that we are pushing to change these structural issues so that this does not have to be the reality for the majority of working families.
Cherita, I think that no, hey, soapboxes are welcome. I was thinking about pay inequity, and this thought came to me, you know, how back in the day, and also maybe today, at some organizations, they'll say, oh, the man needs to make more. So the man's at a company and he has to make more because he supports a family, all of these things, right? And so I was thinking, you know, how about if we flip that and say, well, the woman needs to make more because she has to pay for childcare and she has to, right? I mean, like this formula, like who decided that he should just get paid more? And in my estimation, I'm like, the woman has way more expenses.
Way more. Way more. And not just that, Felicia. So not only is that not back in the day, there was a Times Up did a report just a couple years ago, and they interviewed leadership. They interviewed managers, and the majority of them said that if they had to make a decision between offering a job or a promotion or a raise to a man or to a woman, and there were women in this survey, many of them said they would offer it to the man because he needs the money more. So this is not an archaic, you know, back in the day perspective. This is still very prevalent, and it's prevalent among people that are making decisions, that have power and influence, you know, over working people. And we have to change these mindsets because it's ridiculous. It's ridiculous.
Yeah.
Childcare is right now is for some people 30% of their income. They're paying more in childcare than they are for rent. And
Right.
it shouldn't be more than 7% of your income. And so when you think about that and you think about, you know, the wages people need to just be able to put their children in quality childcare and so that they have the access to better outcomes than their parents do, we aren't set up to do that. So we have to fix these equity issues. I'm sorry, I'm muting.
No, it's fine. Thank you. I do want to point out, and I think the team has just put it in the chat, what's really important is for workers to know their rights, to know the protections. And we will say that the city of Chicago has passed, and not all along, it's because of the advocacy of these organizations here and other organizations not here tonight, pressing the city, pressing government to do what it should do to protect workers. And so there's a number of new protections in place. And I know one of our teams has put that, spreading the word about that is really important, because too often People who are working in the organizations or in our communities they're working, their heads are down, they're working 2 or 3 jobs. They may not know all the rights that are available to them, and they may not know how to access those services when they need them. And so I think it's also important for all of us and all the other organizations that are in the room today to share that information so that we can ensure that we are trying to get to every worker so that they understand their rights, and that women workers understand their rights and are protected. We have a few minutes left. I'm trying to see if there's another question in the chat before I close us out, or any last comments, Jaquie or Katya, since Cherita put herself on a self-imposed mute.
I just wanted to add to, the same notion that
I think she froze.
that
Jaquie,
you're sharing right now,
oh,
right? Like hello.
Can you start over, because we lost you for a minute? The notion, you started off with the notion that.
Yes. So with that notion about labor rights and what happened with people that are unaware of their rights or are too busy, just working and going to the day-to-day like challenges to actually do the research or investigate, etc. That in that immigrant community, in particular with the undocumented community, multiply that by 5 or 10, right? The way that their rights are not respected is out of, it's just it's so shocking to me, right? Unfortunately, we're talking about, the staffing agencies that many times are not respecting even the most basic rights. Many of them, unfortunately, are engaging in wage theft, right? So the things that our community has to unfortunately go through, because sometimes that's their only option, right? Their only alternative. And that's why we need to create different alternatives, right? Like what I was sharing before about, training people as CHWs, training people so that they can actually work in a different environment. People can get creative about how to hire undocumented workers as contractors, etc. You have to get creative in this world, because that's the reality that we live, right? The reality is that between 25% and 30% of the people in our community are undocumented, and they still need to work, right? Somebody has to bring the bread to the house, and that's the reality. And the same thing that has been said about the right and their need for childcare, it goes the same way, even though they are in this particular situation. And that's also why we're pushing so hard, and working with our partner organizations to pass the Build Back Better, because there's a provision there that would actually change the lives of millions of individuals.
Yes, absolutely. Katya, thank you. For the people who are joining us today, I also want you to consider what you can do at home, what you can do in your workplaces, and in your spending decisions. Overwhelmingly, the research shows that women actually control the purse strings in their families. And so you have a lot of power in deciding where you spend your money and supporting organizations that are paying equitably. We put, there's conversation about that in the chat. And I know that Cherita held up an example of a local restaurant that's really leading with their values in that way. This hour has gone by so quickly, and I am energized and uplifted by our conversation and the level of participation from you all. I'm hopeful our collective work will yield solutions that will ensure women emerge stronger than ever. Conversations like this are a reminder of the importance of working in tandem to make a difference across our communities. Tonight is the first of many future SHEcovery sessions where CFW will convene organizations on the front line of real change for women. So please be on the lookout for future opportunities to connect. Once again, I would like to thank tonight's partners, DePaul University Labor Education Center, Enlace Chicago, One Fair Wage, SEIU, Healthcare, Illinois, Indiana, Missouri, and Kansas, and Women Employ. We can't do this work alone, and your continued support is critical. So as you consider your year-end philanthropy, know that a gift to any of these organizations, including Chicago Foundation for Women, will be the much needed fuel to continue our shared fight. We are living through an ongoing pandemic, with needs across our communities continuing to grow. Please continue to do what you can to take care of yourself and others. And I want to thank you all again for joining us tonight. Really, what a great night. Thank you so much. Thank you for your leadership, Cherita, Katya, and Jaquie. Thank you for all you're doing on the front lines, for the advocacy work, the advocacy / protesting / striking, whatever's necessary to get a real change for women and also get women back to work, because that's what this conversation really is about. Women want to go to work and they want to be supported. They want to be safe in that work. And those are the things that are non-negotiable that are on the table. Thank you all so much for joining us tonight. I really appreciate you.
Thank you.